You're listening to Aging Uncensored.
Greetings, everyone. We welcome to Aging Uncensored, another episode today, and we have a very special guest, Dr. Andrew Duxbury, who's someone I've had the pleasure of working with for quite some time now. Andy, I probably would not do a formal opening for you any justice. Do you want to give us a brief overview of?
Hi. My name is Andrew Duxbury, and I'm a professor of clinical geriatrics at the University of Alabama, Birmingham, where I have now been for pushing 27 years. I have been in geriatric medicine for approaching 35 years in toto. And I have a career in what I call community-based geriatrics. And that is, I became very interested early in my career in how do we take better care of older people frail enough to live in an institution or a nursing home who don't, but rather through preference or through economic necessity live at home, because our systems are just not very good with that population. Mm-hmm. So for 35 years now, I have attempted to improve systems, educate people about how to improve systems, provide direct care, and otherwise, just kind of beat on the drum to say, this population is important. We're all hopefully going to get there, and we, need better systems in place.
Absolutely.
Besides that, I have two other careers. One, I am a music theater performer, not today because I have some sort of something in my throat. And my other one is I write, predominantly in essay form, and I have a number of books out if you want all of my opinions on everything.
And you do want his opinions on everything. So I can say I have worked with Dr. Duxbury since I was first in the geriatrics world as a nurse practitioner, and have been very inspired and learned a ton from him, and just love his overall idea of how we approach care for older adults and how we do what makes sense. And I have to say, Dr. Duxbury is also taking care of my father, who does not like medical professionals in general, and has a great deal of respect for Dr. Duxbury, as a lot of people in our community do. So today, and one thing I love about Dr. Duxbury is he's someone that we can have kind of the tougher conversations with, and because you're so knowledgeable, I think. And so what we want to talk about today is sex and aging. I think that this can be a difficult topic for caregivers, for adult children who are serving in a caregiver role. What does sex look like in aging adults, in adults with cognitive impairment, in adults with functional impairment, and how do we navigate that, and overall kind of what's the goal in keeping them safe and keeping ourselves sane, as you've often said in many scenarios.
I believe very much in what I call the safe and sane rule. Patient must be safe, caregiver must be sane. Everything you do tries to meet one of those two goals.
That's right. And I think that there's this kind of idea in society in general that as we age, or as adults age, that sex is not something they're interested in.
Which is entirely untrue.
Right.
Adults remain interested in sex and have sex lives, both interior and with other people, throughout their adult life. It takes a lot of dysfunction of brain and body to really turn off all of those pathways that we all develop in adolescence and develop through our adult lives. Mm-hmm. What changes is physiology and physiologic response, stamina, the availability of partners,
sure,
and the kind of social milieu in which sex can happen.
Yeah.
And not what's actually going on in our insides or how we view ourselves.
Yeah.
Our brain basically grows and changes through childhood and adolescence into young adulthood and doesn't stay the same year to year until our mid-20s. And somewhere around the age of 25 or so, it is fully developed. It's done.
Yeah.
And we think of ourselves as being that person the rest of our adult lives. We look in the mirror going, what the heck? But we still feel like we are that same person. And so we're going to have those same general kinds of attitudes towards sexual expression as we did when we were in our 20s, even if our flesh is not necessarily the same.
No doubt. I know in clinical practice, so some kind of scenarios that have been presented to me before, and probably the same scenarios that have been presented to you in clinical practice is you have an adult child or who's in a caregiver role, and maybe they've recently moved mom into a facility, say, an assisted living, and mom has met a friend there, who seems to be a partner.
Right.
And the adult children raise concerns about, all kinds of things. Like, is it safe? Is there consent? Like,
that's the big issue, is the issue of consent.
Mm-hmm.
And there is a difference between those who are in senior living independently or even in assisted living and those who are in memory care or specialty care, assisted living or dementia care, or however your locality defines it.
Yeah.
The minute somebody is placed in a dementia situation, there is an assumption that they cannot protect themselves
Right.
against the world, and they are therefore not capable of giving consent.
Mm-hmm.
And so the rules and regulations in the majority of states forbid sexual contact in dementia living between residents because of this issue of consent. In regular assisted living, it is not necessarily encouraged, but it is really no different legally than living in your own home or your own apartment, where if you want to invite somebody home, that's your business.
Right.
And not the business of the staff. Now, the staff may have rules which may come down to something along the lines of, leave the necktie on the doorknob, as they used to in the dorm.
Yeah, don't deliver dinner when the necktie is on the doorknob.
But there is nothing, to forbid it. And people in those situations are considered capable of making decisions and giving consent and having who they want involved in their lives in which way.
Yeah.
Now, children tend not to view their parents as sexual beings.
Sure.
And this has always been true.
Sure.
And
absolutely.
it doesn't change even when the children are 60.
Right. Yep.
And the parents are 85.
Right.
So they will always have a bit of a psychological issue with the idea that mom or dad wants to, explore or experiment or get involved with a new partner. But they really don't have an ethical or legal leg to stand on to forbid it. Again, if they're in dementia living, yes, they do.
Sure. So if they don't have dementia, it's really about them being safe and the caregiver being sane, right?
Exactly. Now, there are a lot of people out there in senior living who are just like there is anywhere, or may not be the most ethical of individuals.
Mm-hmm. Sure.
And there is also a huge generational shift that's happening at the moment. Those in the 70s, are now all members of the baby boom generation who have a very different attitude towards sexuality and the forming of relationships then the silent generation who were above them, the silent generation, are now all in their 80s and 90s.
Yeah.
And we see this play out in independent living communities. The thing in heterosexual relationships that's usually curtailed a whole lot of more casual sex is the risk of pregnancy.
Yeah.
And older populations, that's no longer an
Right.
issue or a bone of contention. And therefore, relationships will often, in the aging boom, develop more casually. And how we can tell is some of the highest rates of sexually transmitted infections are in active senior communities, like the Villages in Florida, which is the very famous one, which is enormous, has STI rates which are way above any of their neighboring communities.
Yeah.
Because it only takes, one person to bring it in, and then
Sure.
we're all
we all
sharing.
share. Correct. And most STIs are treatable illnesses. One thing I think about is aging individuals with HIV. And HIV is is a chronic illness that is very well managed now, and they're also
It's so different from when I was a young man.
Exactly. And I've heard the argument before that sometimes it's better to have HIV than diabetes, and I just in the sense of the
Statistically,
havoc it does on your
you
body.
will live longer and more healthy with HIV than you will with particularly type 1 diabetes.
Right.
Absolutely.
Exactly.
Statistically, if a 25-year-old man were to become HIV positive today, his life expectancy is within months of the 25-year-old man who does not have HIV. Really, there's not a whole lot of difference.
Right.
The initial generation that developed HIV and survived due to luck or genetic good fortune or hardiness or whatever are now in their late 70s and early 80s. So there is a huge cadre of geriatric HIV individuals out there.
Yeah.
The HIV specialty clinic at UAB, for instance, is looking into hiring a geriatrician to help manage that particular population, because they see what's going to happen as more and more of the younger men who've been living with it just fine for years continue to age. I wish them good luck. We can't find geriatricians to work for geriatrics.
Yeah.
Good luck finding one to work for HIV and infectious disease.
Yeah, I know. Yeah. What about, so I think that just makes me think, like, as a provider, like in clinical practice, I don't know if I've always, like, if someone presents with symptoms, if a 75-year-old female presents with symptoms, urinary symptoms or, something along the lines of that, like, I don't know if it's always at the top of my mind, like, to consider STIs,
Yeah, it's not. We all have our cultural biases, and when someone comes in looking like our grandmother, we don't immediately start thinking of her as a sexual being.
Right.
And, I've certainly, the one time that I absolutely missed HIV was in an 82-year-old woman.
Oh, wow. Yeah.
And somebody else picked it up. And I just...
sure.
Didn't ever occur to me to give her an HIV test.
Yeah, sure. I think that's a good, like, reminder as a provider to just be aware.
I think it's just wise to, as a part of a laundry list of I'm just checking through your general health things.
Yep.
To say, do you have a sexual partner these days?
Yeah.
Yes or no, and just to at least, because if it's no and the answer no and I haven't for years, you can assume that STIs are probably not going to be an issue.
Yeah. So what about, there's medications. So like specifically, for erectile dysfunction and things like that. Talk about those a little bit, and like in our aging adults, like how that can be different, and and when it's safe and when it's not safe.
Well, the erectile enhancers, there's a number of them. The ones that we're all familiar with from the ads, if nothing else,
Yeah.
are Viagra, Cialis, and
Yeah.
what's the third one? Levitra.
Yeah.
And they are all related to each other. They all work roughly the same way, and they basically allow for more blood flow to the penis so that erection is easier to achieve and to maintain. There's not a lot of downsides to those medications. They're pretty safe in most men.
Mm-hmm.
There are some exceptions.
Mm-hmm.
They mix very badly with certain kinds of medications, which also are designed to increase blood flow.
Yeah.
Nitrates, which are used for heart disease, alpha blockers, which are used in blood pressure treatment of that. So you just have to double check and make sure that you're not going to cause trouble, by using it. The big question I ask any man out, and I have lots of men who will ask me, and I generally don't have a problem prescribing them, but is if they are married or I know that they have a fairly significant, partner with whom they are active or would like to be active, is I don't prescribe them without bringing her into the conversation.
Yeah.
Because the surprise, honey, is never a good thing.
In any aspects of a relationship, that's usually never a good thing. So I love that point there. I wouldn't have thought about that.
Yeah, no, that you really have to say, okay, this is something that that this is about both of you.
Yeah.
You both want to try this, and if everybody is okay, great. And I don't have any problem, putting people on it at all.
Sure. I think one thing I've seen is and that I always, in any kind of medication, warn families and patients about is compounded, compounded blue pills that you can buy.
Well, you can buy a lot of stuff at the gas station, and it's all caveat emptor. Who knows what's really in it and what it's going to do to you or to other medications you may take.
So I think we can agree that those should always be avoided.
I would suggest that they will be gotten by prescription. Now, they are not the cheapest drugs, and there are a number of mail order pharmacies that sell them. There's a quick video visit with a prescriber of 30 seconds duration.
Sure.
You're probably getting reasonable product through those.
Yeah.
As opposed to at the mobile station.
Agree. Totally agree. I think anything where there's a 1-800 number, call now, but wait, there's more, you should avoid that in general. And I think even if you're going to utilize one of the telehealth, mail order type situations, talk to your primary care provider about it too, because there's just more conversation that needs to be had around the safety of that.
Yeah. Because I have seen men who have had strokes from mixing erectile enhancers with medications that it shouldn't, and nobody needs that.
Right. That's not helpful. What about medications that do the opposite? Are there medications that we can use, say if we're,
Well, some demented men can become kind of hyperlibidinous. And this becomes an issue because most caregivers are women, and they can become, annoying.
Sure.
To their caregivers, particularly if they require, bathing assistance and personal care and things of this type.
Right.
There are things that we can do to kind of, slow things down a bit. The most usual one is what are known as the SSRI antidepressants, which are the Prozac family. I don't like Prozac, particular in older people, but Zoloft or sertraline, Celexa or citalopram, and Lexapro or escitalopram tend to work relatively well and will bring things down that notch so that everybody can get along with everybody else.
Right. Yep. And generally, a lot of, generally those medications are pretty well tolerated.
Yeah.
They're not expensive.
Yeah,
Providers,
those are pretty easy, and most
Right.
providers are pretty familiar with them.
Exactly. Exactly. So if you're an adult child or caregiver and we talked about already, like for someone who doesn't have dementia, like it's really about staying safe and sane. If you're sane, they're safe, it's okay.
The other thing I would do is I would separate companionship from marriage. In that we all need companionship
That's right.
of one kind or another.
Right.
And if mom or dad has become widowed,
Yes.
their needing or wanting or looking for companionship is absolutely understandable and a basic human need.
Yeah.
Marriage is a contract. And it is
Yeah.
a legal contract about responsibilities to each other, which often involves financial issues.
Yeah.
And it is perfectly legitimate to have companionship outside of marriage.
Absolutely. Yeah.
And there are a lot of times significant issues which can arise when there is a late life marriage between people with, very different estates, different families with
Yeah.
very different ideas.
That's really challenging.
And that can be a real problem.
Yeah. For sure. For sure. How do you navigate that as an adult?
Everybody's
child?
got to do it on their own. There is no right way
Yeah.
to do it.
Yeah.
Because there, particularly when we're dealing with, marriage and sexuality and that, there are religious traditions that say that sexuality does not ever belong outside of marriage and things
Right.
of this type. And it's tough. But there are also, you will find that most men don't remain widowed very long. They remarry very quickly. One, because they've got a much broader pool of individuals from whom to choose. There's a lot more single women in the older age group than there are single men.
Yeah.
And two, for the most part, they have not been socialized to be able to care for themselves without a woman involved. They've got to have somebody. They don't know how to cook and clean and keep the house and do all those things that just kind of happened that kept them comfortable for all those years. So they fill that gap. Same thing is not true on the women's side.
Yeah.
Women are, for the most part, quite capable of living alone, and many of them do. It's been expected that something like 50% of the women over the age of 75 will be single.
Wow.
Between divorce and widowhood.
Wow. That's wild. Yeah. I definitely see that, And
And the women are starting to come up with alternate arrangements. There's a lot more co-housing or communal living or, let's get the big house with 6 bedrooms and we all take turns cooking and taking care of things, and we all operate as, as distinct individuals, but we can support each other. And the women will do this, the men don't.
Right. Yeah. No. You're absolutely right. That's what I've seen too. And I think speak to that, like it's really hard sometimes for adult children when men remarry very quickly, or, like say their mom dies and dad remarries in 6 months and they're like, what the heck,
Because they're still grieving and in their grief process, and dad is just trying to survive.
Right. Yeah. 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 I think like trying to take, that's such an emotional thing, but trying to, view it from that point of view, like gives you some perspective and to help it make a little bit of sense.
Oftentimes, if mom has been ill for some time and knows that she's terminal and she knows that she's going to leave dad a widow, particularly the silent generation, mom will start looking around for her replacement. And may facilitate.
Yeah.
I have seen that pattern a lot.
Huh. Interesting. do you feel like that's been a pattern you've seen here in the South?
I've seen it everywhere.
Everywhere? Okay. Yeah. That's very interesting. I haven't thought about that, but now that I think back, I think I can think of some scenarios that might apply. So.
Well, I'm still managing. She knows what her husband needs, and she won't be able to provide it. But okay, I can make sure that this is going to work.
I'll find someone who can. Well, I mean, it makes sense. Absolutely makes sense. Well, I think this is great. I mean, I think like what I want people to take away from this is like having sex into old age is totally normal.
Absolutely.
Totally normal. And I love the point that you made about like adult children not seeing their parents as sexual beings. I mean, that makes total sense. And I know I've been in situations before with family members and caregivers where there's been all kinds of like, even like sexual trauma and things that come into play there that make the situation even harder for them. Yeah. And so just recognizing that, like, you know, that's a tough spot to be in.
Well, you know, we have two great taboos in our society. Sex is one and death is the other. And we just don't have good communication tools about either one. And when you're looking at older individuals, you're often looking at both together. Yeah. And that becomes even harder.
Yeah. Yep. Absolutely. Well, so I think, you know, just know, like, as you're caring for older adults and you're navigating your parents or you're navigating old age yourself, like, hopefully this helps just sort some of those icky conversations out for you all and give a little bit of insight and knowledge into how to handle them.
And if you don't know how to have these conversations with your parents, the best thing to do is to get somebody, whether it's a physician or a counselor, or somebody who can help navigate.
Absolutely.
Will just make life a whole lot easier.
That's exactly right. Someone who doesn't have any emotion tied to it.
Correct.
You know, that's always, anytime there's a tough conversation to be had, if you can have sort of a mediator who doesn't have emotion tied to it, it goes much easier.
Absolutely.
So, well, thank you so much for talking to us today.
It's been a pleasure.
I really appreciate it.
Absolutely.
So that's all that we have for today. But before you leave us, be sure to like, share, subscribe, all the other things. Tell a friend, tell a neighbor about Aging Uncensored, and we look forward to seeing you next time.